Hello guys, welcome back to Dr. Hill's Academy. In today's video, we're discussing the anatomy of the axilla. If you've not subscribed, do well to subscribe. Stay tuned. The axilla is a pyramidal shaped structure found here within this area. Okay, so this is the arm, this is the chest wall, and between the chest wall and the upper part of the arm, there is the axilla. And the axilla is pyramidal shaped, filled with fatty tissues. Whenever you hear space in anatomy, you should pretty much think of fatty tissues because fatty tissues are found almost always in spaces for cushioning effect. Now for the axilla, we'll look at it from this pyramidal shaped structure over here. So you can see this looks like a pyramid. The upper part is narrower, the lower part, the base is wider, and then the upper part is the apex. The lower part is the base. Then we have the medial wall. If I ask you what the medial wall is, you should be thinking of what I said, the upper part of the chest wall. Then the lateral wall is the upper part of the what? Arm. Okay, so this is the lateral wall. Lateral wall. And we already know this is our medial wall. The base is this area over here. The posterior wall is behind. Posterior is behind, and you should think of it this way. So that's the posterior wall, the anterior wall, the lateral wall over here, medial wall, apex. Now, we'll study the boundaries one by one, starting with the apex. The apex is also called the, can you guess it? Cervico-axillary canal. Why is it called cervico-axillary canal? I'm sure if you look at the compound word, you see that there's the cervical and there's the axillary region. That's why it's called cervico-axillary. You know, the axilla is responsible for transmitting structures from the neck to the upper limb. You know, when you are transmitting structures from the upper limb, neck to the thoracic region, it passes through the thoracic inlet. It passes through the, you see something like this. You see something like this. That is the rib, first rib over here. Then you have your sternum, you have your vertebra, something like this. Then this is the first rib. So this is the thoracic inlet. So structures pass from the neck through this region into the thoracic cavity. However, for the axilla, structures pass from the neck to the side here. We'll have something like this over here. From the neck, goes through here into the upper limb. But for the thoracic inlet, is from the neck into here. I'm sure you got the illustration. So, looking at the apex, the cervico-axillary canal, we have boundaries of the, or borders of the apex. One of them is the clavicle. So we have the clavicle. The clavicle, we have the scapula, and we have the first rib. You know, in anatomy, sometimes they want you to be a little more precise. And for precision's sake, we label here as the upper border of the scapula, the lateral border of the first rib, because you know this is the medial border, and this is the part that leads to the thorax. Okay, so this is the medial border, this is the lateral border of the first rib, and then for the clavicle, this is the posterior border of this clavicle, this is the anterior border of the clavicle. You know that if you look at the diagram above, you would see that the thoracic inlet is over here for the thoracic region, then the apex of the axilla is over here for the structures going to the upper limb. So This is the medial. This is the medial border. This is the medial border of the apex. This is the anterior for the apex, and this is the posterior for the apex. So we've studied the apex. The apex is just a hollow region. So there's nothing covering the apex. It's just open, and structures pass deep or pass within it. So if you look at the other borders of the axilla, there is let me label the orientation for you. This is the medial aspect. This is the anterior. This is the posterior. This is the lateral. So we can see that there's the posterior, medial, anterior, and lateral. The anterior, medial, lateral, and posterior. So which should we go first with? Let's go with the anterior part first. So if you look at the anterior part, you see two muscles. Two muscles form the bulk of the anterior part, and those are the pectoralis muscles. So let me wipe this off. So we have the pectoralis muscles. This is the pectoralis major, pectoralis major. This is the pectoralis minor. You know, you can also call this P major, P minor. In reality, there are two planes, right? Two planes, the anterior plane and the posterior plane of the anterior border. So the two muscles, one is anterior, one is posterior, but they are for the anterior border of the axilla. And the P major is the one in front. The P minor is deep to it. So there's the superficial and deep planes. Now, if you look at it, you see that there's the subclavius over here, and there's the clavipectoral fascia, which surrounds the what? P minor, and continues down. So it continues down as the suspensory ligaments, right? So you can say that the anterior border consists of the what? P major, P minor, subclavius, what else? Clavipectoral fascia, clavipectoral fascia, and which other one? Okay, that's all. So basically, it consists of these structures, but then this is superficial and this is deep, all for the anterior border. Now let's go over to the medial border. The medial border consists of the ribs, upper four ribs. So we have our upper four ribs from rib 1. It counts down 1, 2, 3, 4. The corresponding intercostal spaces between them and the intercostal muscles, together with what? One other muscle here, known as the serratus anterior. Known as the serratus anterior. Now the medial border consists of what and what? 1, the upper four ribs. 2, corresponding intercostal spaces and muscles. You know, there are the intercostal muscles. That's the muscles between one rib and the next rib. So there are two intercostal muscles anyway. We'll discuss that later in our other videos. There's external and internal intercostal muscles, but that should not bother you now. Then we have the third one, the serratus anterior. So if you look at these muscles, if you look at the serratus anterior muscles, the corresponding intercostal muscles, and the upper four ribs, they are within the medial border or boundary of the axilla. So let's move to the posterior boundary of the axilla. The posterior boundary of the axilla consists of three muscles, basically the SLT. Okay, so we have the SLT muscles. The SLT muscles are the subscapularis, latissimus dorsi, and teres major. So here we have the S, which is your subscapularis, and then you know that the subscapularis is found on the anterior border of the anterior surface of the scapula. So from subscapularis, sub on the ventral, and then that's ventral surface, and then scapularis, scapula. Then we have two other muscles, the latissimus dorsi and teres major. So we have latissimus dorsi here and teres major here. So you can see that the latissimus dorsi arises from the intertubercular groove over here. So this is the intertubercular groove. We have the latissimus dorsi from the intertubercular groove of the humerus. This is the humerus. So here is the intertubercular groove, this groove here. Then we have another muscle, the teres major, from the medial lip. These are the lips of the groove. So the medial lip of the intertubercular groove is where the teres major originates from. You should already know that the lateral lip of the intertubercular groove is where the P major, that's pectoralis major, originates from. So we've already talked about the pectoralis major in the anterior border of the axilla. Now we are interested in this teres major on the posterior border of the axilla. So the teres major is from where? The medial lip of the intertubercular groove. So we have the teres major. Okay, so these are the three muscles that form the posterior boundary. Now let's move over to the lateral boundary. The lateral wall consists basically of this area over here. Okay, let me mark it X. This area over here, then these three tendons. That's what makes up the lateral wall. This area over here, labeled X, is the intertubercular groove. And then the tendons are one, the tendon of long head of the biceps brachii. Then this other one is the tendon of coracobrachialis. And then this other one is the tendon of short head of biceps brachii. So you can see that there is the biceps brachii, long head and short head, and then there's the coracobrachialis. So you can see that all these, the three of them, the intertubercular groove and the three tendons, make up the lateral wall. So there's another boundary of the axilla, which is the base. The base consists basically of the axillary fascia. The base consists basically of the axillary fascia and the skin. So if you open the skin from the skin of the armpit from here, after removing the skin, you see the axillary fascia, which is basically a deep fascia. Why do you think the armpit is curved this way? Have you wondered why? The armpit is curved this way because if you look at the base of the armpit over here, remember what I told you about the anterior wall having the superficial and the deep areas, the superficial being the P major and the deep being the subclavius, clavipectoral fascia, and the P minor. So The lower part of the clavipectoral fascia is called the suspensory ligament. So the suspensory ligament attaches to the axillary fascia. Remember, we have our P minor over here and our subclavius over here. And then this is the suspensory ligament which attaches to the axillary fascia and it pulls it up, forming the hollow. So let's look at the contents of the axilla. That's the contents of the axilla. For the contents of the axilla, just remember we have three major contents. One is the neurovascular bundle. Two is the fats. And then three is the lymph node. So think of these three contents and then I'll break each of them one by one and tell you the full contents. For the neurovascular bundle, we have the following structures. One is the cords of brachial plexus. I don't know if you've studied brachial plexus, but we'll release a video on brachial plexus soon, and then you know what I mean by cords of the brachial plexus. It's just part of it's a part of the brachial plexus, and then is a nerve. So another nerve, this is one nerve or one group of nerve. Another one we'll talk about is the intercostal brachial nerve. And the third one, so the intercostal brachial nerve runs between the thoracic region and the upper limb. So it runs through the axilla in a horizontal fashion. And then the third one we have is the long thoracic nerve of Bell. Of Bell. And then it has the root values C5, C6, C7. For this other one is T2. But we'll study it when we study the brachial plexus. T2, this other one is C5, 6, 7. Now we've covered the nerves. Then for the vessels, we have the axillary artery. And then we have the second one, which is the axillary vein. We move over to the fats. For the fats, we have two structures, basically the fibrofatty tissue and the axillary tail of the breast. Or you can say axillary tail of Spence. Then for the lymph node, we have the axillary lymph node. So if you want to remember the contents of the axilla, you think of three structures: the neurovascular bundle, the fat, the lymph node. Neurovascular means nerve and vessel. So for the neurovascular bundles, what are you thinking? Nerve and vessel. For the nerve, you are thinking three. That's the cause of the brachial plexus, intercostal nerve, and long thoracic nerve of Bell. But you remember that this cause of the brachial plexus is not just one nerve. Okay, but just remember it as cause of the brachial plexus. We'll study the brachial plexus in our next lecture. So for the vessel, that's the vessel part of the neurovascular, we have the axillary artery and axillary vein. Then we'll go over to the fat. For the fat, we have the fibrofatty tissue and axillary tail of breast. Then the breast is basically a fatty tissue. All right, so we have the fibrofatty tissue and axillary tail of the breast, axillary tail of Spence. So it runs from this region into the axilla. And then for the lymph node, we have the axillary lymph node. So let's look at a clinical correlates or clinical correlation related to the axilla. The one we'll be talking about now is the axillary dissection. Probably when we are talking about the axillary lymph nodes, axillary vein and arteries, we'll release videos on those. We'll discuss clinical correlates related to those ones. But for now, let's look at just the axilla. And now, the one we'll look at today is the axillary dissection. If one has a cancer, okay, cancer, maybe a breast cancer, breast cancer could move to the axilla through the lymphatic drainage. So when there's a malignancy of the breast, there could be enlargement of the lymph nodes of the axilla. That's the axillary lymph nodes. So the doctor would want to dissect or open up to remove the lymph node and do a biopsy. And that process of dissection or open up is called the axillary dissection. And during the axillary dissection, there's some structures that are at risk of damage, which are our TILT structures, our tilt structures. Okay, so we have our tilt structures which can easily be damaged or at risk of damage during an axillary dissection. So we have our T, which is a thoracodorsal nerve. And when there's a damage, you expect that the latissimus dorsi is not supplied and it's weakened, and the actions of the latissimus dorsi are affected. We'll discuss the actions of latissimus dorsi in other videos. Then for the eye, we have our intercostal brachial nerve. So what's the intercostal brachial nerve? If you've been following, you will know that the intercostal brachial nerve is from the T2 root, and it runs from the thoracic region through the axilla in a horizontal fashion to the arm. That's the medial aspect of the arm, to supply the medial aspect of the arm, and then the floor or the base of the axillary. That's the floor of the axilla, rather. Then we have our L, which is the long thoracic nerve of Bell. The long thoracic nerve of Bell. And if you have been following, you see that it's C5 to C7 roots. So C5, C6, C7, and then it functions to supply the serratus anterior. And if you push your hand against the wall, you see that there will be winging of the scapula. The scapula will protrude backwards. And then we have the T, which is the thoracodorsal artery. Dorsal artery. So you should know these structures that are at risk of damage during axillary dissection. I'm pretty much sure you guys enjoyed the lecture. Do well to subscribe, like, share, and put your questions in the comment section below. Thank you, and see you soon.